We work closely with the HCA and are proud to be here at the Healthier Washington Symposium. I think it's a tremendously important conversation, and one of the things that I've taken away from today has been the diversity of not only focus areas but solutions. And I think that that's one of the key things that as we look at transforming healthcare and improving the experience for Washingtonians, it's going to take a wide variance of solutions and answers.
It's very exciting that we're at a major meeting about health and we're talking about behavioral health. I think that in and of itself is already great. I'm a psychiatrist. I chair the psychiatry department at the University of Washington, and we have had many years where we've just worked in isolation in silos, and in the last couple of years we've started to talk about the fact that the brain really is a part of the body, that mental health and physical health really should be brought together if we want to do whole person care. And for the last few years I've heard a lot of arguments about why we shouldn't do it. You know, people are in silos, people are worried about it when you break down all those silos, and at this point I think we've gotten to a stage where I'm not hearing those arguments anymore. I'm hearing people talk about how we should do it. And I think we're starting to see examples all around the state of people really providing nice integrated care where behavioral health providers and primary care providers are working together to care for patients. And it's beautiful when you see that.
It's excellent. It's touching on some very, very salient points that are important for our communities as the movement towards holistic healthcare expands. In general, I would like to look at more empowering the community that accesses healthcare and behavioral healthcare. So how do we do that in a way that makes sense for everybody and that the care is successful?
I'm a little disappointed I couldn't get more of my co-hospital commissioners here, because it's a different perspective from a lot of what's being discussed in here. This is a great gathering of people, all with very, very differing views, but still with a very similar goal of creating very good health care for the state of Washington.
But I think the beauty of Healthier Washington is that it's so ambitious and it's really trying to tackle so many different elements, but we need to all be more deliberate and intentional around drawing out the different connections that really make this entire system work.
For me, it's a great experience. It's awesome as a small town provider to be able to come and have some opportunity to provide some small amount of input into this broader system. You know, we've got so many people here today that all in their own way are working so hard to improve our medical system, and it's such an important dynamic time in medicine that it's a great opportunity to bring all these folks together, and for me personally to be able to kind of have a role in it has been very cool. Yeah.
One of the things I really appreciate about Healthier Washington is I do think rural communities have been a part of the conversation. We have the Rural Health Accelerator community. We also have a couple of payment reform initiatives under Payment Model 2, and so I think those have been a great way to highlight the unique challenges of meeting those needs of our rural communities. There are unique challenges around capacity building in those communities, but there's also unique opportunities, and so I really like the way Healthier Washington has allowed us to put a focus there. I think particularly in terms as we think about how do we move rural communities towards value, that's really difficult with low volume populations. But I think that, as we're able to go through this process of looking at how to move to value, I think our rural communities want to get there. They have a real link, rural providers do have a real link to their community. They want to better serve their community, and to the extent that we can design payment systems that reflect those individual community needs, but also really sustain the key access so that every community in Washington State can meet those essential services, can reach those services in their community. I think that's really important and something that we need to continue to focus on as we move forward.
I think this is an excellent opportunity to bring the stakeholders together, to really involve community and have good conversations and ask very difficult questions in a very open setting and really put in some action steps. It's such an active learning opportunity. It's not a passive when we're just sitting here listening. We get to speak. We get to interact with our elected officials, with our government officials that are taking roles and taking stands and going to take this information back and figure out what we need to do next?
Yeah, I'd say I'm really encouraged that people are thinking actively about community members, patients, consumers, and their role in the process. I think we have a long way to go to figure out how to really integrate people effectively into this big transformation, but it's encouraging to hear that people are interested in figuring that out.
What I really appreciate about Healthy Washington is that we're no longer allowing the silos to exist. It's an initiative in which the pieces are working collaboratively to be a whole. The other is, I just want us to be the best in the world at doing it. It's not just an issue of pride, it's an issue of being able to have something that is exportable to other states and other cities so that everybody can be healthy, and we have a lot of work cut out. But if it's going to be done anywhere, it's going to be done in this state.